Alright, so I am coming in to do a cap change on my patient's Cvad. I just checked the doctor's orders, and this is the appropriate time to perform this. So I've already checked my patient's bracelet and done my PPID. So I'm confident that my patient is who her bracelet says she is. So first thing I'm going to be doing is getting my caps ready. And before I entered my patient's room, I put on hand sanitizer. And I've already greeted my patient. We're good to go. So I'm getting my caps ready here. And inside these containers, they are sterile. And these are being reused, so they're a little trickier to open. So I'm going to attach them to my normal saline. And being careful not to touch the sterile end, I attached it to my normal saline. And now I'm going to remove all of the air inside the cap, inside the normal saline, so that's good to go. I'm going to do it for my other one, my normal saline. So I'm removing the normal saline cap, and I'm not touching the sterile blue end, and I'm attaching them, and removing the air. And I'm doing two because my Cvad has 2 ports, so when I'm doing a cap change, I have to do both caps. So now I've got these 2 prepared, and my Cvad is non-valved, which means it has a clamp. So I'm just gonna get my heparin ready here too, because I know I'm gonna be using it. So I wanna make sure I'm getting rid of all the air in my heparin. It's tricky to do with the cap on, so I'm gonna take the cap off. And I'm gonna put it back on just while I'm not using it. Okay, so I'm ready to change the caps. I'm gonna put on some gloves. So, first I'm going to clean the old cap. And I'm gonna clean the top, the sides, all the way to the bases, because I'm gonna be removing this cap. I'm gonna clean that for 30 seconds. Now I'm going to remove the old cap, grab my new one, and I'm not touching inside there. Touch them. There we go. Now I've already removed all the air. I'm just going to unclamp, and if I actually do my flushes, it's going to spray all over me, so I will clamp it for the sake of this video. But in real life, I would unclamp. I would do a flush of 10 cc's of normal saline, and I'd be doing a push-pause technique, and on my very final push, I'd be locking to maintain that pressure. So now I've already done my flush in this hub, so I'm going to remove the normal saline, and I'm ready to do the next one. So same thing, grab my alcohol, going to clean the old cap, including the sides, and down to the base of the old cap. Now I'm going to remove that old cap, and I'm not going to touch the exposed hub. This one ready to go. Touch those, maintaining sterility. And same thing, I'd be doing 10 cc's of normal saline, unclamp, push, pause for 10 cc's. On my final push, I'm locking to maintain that pressure. So let's do that one. And now, like I said, because this is a non-valved Cvad, I need to heparin lock. This is to prevent any clotting that could happen. So first, what I need to do is clean the port. So I'm going to do the straight one first so that I know the angled one's next. So I'm going to clean this end. 30 seconds. Perfect. Take off the cap. Detach. Now this one, I'm not doing a push pause, I'm just doing a gentle push of about 3 to 5 cc's. So I would unclamp, gently push the 3 to 5 milliliters of heparin, and then while I'm pushing, I'm locking to maintain that pressure. Again, I didn't actually do it because I don't want to spray myself. So I'm undoing that heparin and I'm keeping the end up and out of the way so nothing's touching it, because I'm going to, so I can put that down because I haven't cleaned it yet. And I'm really watching the end here, keeping it clean. So now I said I'm doing the angled one. So for 30 seconds, cleaning here, 30 seconds has passed. Now I'm going to attach to the angled one, my heparin, and again, unlocking, gently pushing 3 to 5 milliliters of heparin, and then while I'm pushing in the fluid, I'm going to lock. Perfect. Okay, so now my caps have been changed, both of them, and they've been flushed and heparin locked, so now I'm ready to do my dressing change. What I'm going to do first is I'm going to open up my dressing tray, and I can remove these. So I'm going to move my equipment closer to me so I don't have to reach over my dressing tray. These are all the things I'm going to be putting into the dressing tray. So, here we go. And I'm opening my dressing tray now because I want to reduce the amount of time that my patient's underneath the dressing is exposed. Because with Cvads, it's a direct catheter to heart, and there's a high risk of infection. So I want to just get this out of the way. Might need that later. I'm not sure how good my aim is for, oh, you know what, that's stuck, so that's fine. So now I'm putting in my chlorhexidine swab into my sterile fields. I'm gonna do 3. Come on. This one seems to be stuck. Oh, that probably wouldn't happen in real life. So now I'm going to do my skin prep. And I'm going to put in a couple 2x2 non-woven sponges, just in case I need them. You never know. Probably just one is good. Okay, and I've already put in those. I'm going to put on my mask now so I don't forget. This is to prevent any microorganisms or anything like that that could be in my breath from contaminating my patient's Cvad insertion site. So first what I'm going to do before taking off the old dressing is I'm going to measure the length of the catheter that is outside the body so that I know that when I put on the new dressing, it's the same amount of catheter that's out of the body, so I know it hasn't moved. So good, I've got that measurement. Now I probably would still have my gloves on, or maybe I'd put on new gloves. So put on new gloves to take off the old dressing. Okay, so I'm gonna start peeling off the old dressing now. I'm starting at the corners. And this is difficult to get off because it's a textbook, not a human. But peeling around the edges, not touching inside where I've previously peeled. And when I'm pulling off, I want to pull, oh goodness. I want to pull like towards the catheter so that I'm not pulling it out. So there we go, I've got it all picked up. And I'm going to, I've got something there. There we go. Good. And then outside of where the dressing would be, peeling off that last bit. And because this is not actually inserted into my binder here, I'm going to have to just put it back on there. But let's say I didn't just touch inside my Cvad under the dressing. So now it's exposed. I'm just, while I am cleaning my hands, I'm putting on my gloves, and while I'm also just checking to make sure there's no redness, swelling, inflammation. It looks good, the site. I'm not concerned. And I just touched inside of my sterile dressing tray field, but I will, the inside of this one is sterile. So I'm just gonna shift that up to cover the spot that I just touched on my sterile field. Okay, now I'm gonna put on my sterile gloves. Okay, now I am sterile. I can touch inside here. So first thing I'm gonna do is I'm going to clean my chlorhexidine swabs. So again, this isn't really actually inserted into my patient, but I would use one pad, and I'm going to go back and forth, and I'm gonna do the width that my old dressing was, and I'm working away from the site out. Now I'm flipping to a clean side, and I'm going same thing, outwards, the same width that that dressing was covering. Now this one's garbage. I'm gonna grab a new one. And I'm cleaning, oops, I'm gonna use my right hand because I'm right-handed. But I'm moving back and forth the width of my dressing, flipping it again. And I think normally with a Cvad it wouldn't be normally, so it's not gonna move around like this. So I'm just gonna anchor this for the purpose of the video, but I'm going back and forth. Go. And again, I wouldn't have actually touched that, so this hand is still sterile. So I'm going up the catheter. Okay. So next what I'm gonna do is use my skin prep. And I'm just gonna put in the area around with the dressing to help it stick. Okay, don't actually need these anymore. Okay, now I hope that dries. And just before I put on my new dressing, I'm going to break sterility with this hand to grab my ruler. And I could have a sterile ruler in my dressing tray. I could have added, but I don't. That's fine, I'll just hover over top. And it's the same length outside the body, so I'm happy with that. I'm only touching the back side, nothing that's going to be actually touching side. And I'm going to place that top, and now I'm fine to touch wherever because it's covered up. Okay, going to remove paper around the dressing. Perfect, and I've got this label here. I'm going to put my initials and the date, and I'm going to paste it over top. And just kind of to the side, because I want to be able to see that insertion site. And that's everything.